A lot of people dream about having flat and well-toned abdomen. Some can achieve it through exercises and weight control, but some may not. And the reason for that is signs of natural aging, heredity, history of pregnancies, significant weight changes, or prior surgeries. The abdominoplasty is not a method of weight reduction. The right time for surgery is only when you have achieved your desired weight and it has been consistent for some time. These kind of surgeries shouldn't be performed if significant weight loss is planned or a patient has big body mass index, if patient considers future pregnancies, have severe health conditions like heart diseases or uncontrolled diabetes, or heavy smokers. Abdominoplasty, also known as tummy tuck, is surgery in which excess skin from the anterior part of abdominal wall is removed. In many cases, we combine it with liposuction from upper abdomen or flanks or any other area where we see a fat disproportion in body. And if needed, abdominal muscles can also be restored in the right position if they are weakened or separated. If we perform abdominoplasty, the incision goes in the lower part of waist, so the scar is always hidden under the underpants. If the patient has undergone a C-section, then we use the same scar, just make it a bit longer to the sides, and if needed, correct the previous scar. Stretch marks, if there are some, can also be removed in this surgery if they are placed in the area of excess skin. How to prepare for the surgery? First is the appointment with plastic surgeon, where we discuss medical history, do some physical examinations, discuss expectations, and the patient always receives all the information about prognostic outcomes, risks, scar localization, and all the other questions. Second is lifestyle adjustments. Patients shouldn't smoke before the surgery and at least 1 month after surgery. Maintain stable weight. Avoid or change certain medications to prevent excess bleeding, and arrange help during recovery period at home. Surgery is performed under general anesthesia. We perform the surgery while you're asleep and don't feel any pain. Typically it takes 1.5 to 3 hours depending on anatomical variations, prior surgeries that have left some scars, extra procedures like liposuction. And patients stay in clinic for 1 night. After the surgery, there is dressing over the incision line for first couple of days. Small silicone tubes are sometimes placed to drain any excess fluid from the operated area. Patients usually have moderate pain, which is controlled by painkillers. There is a compression garment as a support and for reducing swelling for first at least 4 weeks after surgeries. And for first 6 weeks after surgeries, there are physical restrictions. Avoid stretching, lifting heavy items, going to gym. And follow-up visits with your doctor are usually done 1 week after surgery, then 1 month after surgery, and then 1 year. And of course any other time in case they are needed. Final results can be seen usually somewhere between 6 and 12 months after surgery. And usually they are long-lasting for patients with constant weight. Patients visit us from not only Latvia or Baltic states, but also from Scandinavian countries, from United Kingdom, from Germany and Switzerland. We can offer individual approach for every patient, including preparing for the surgery, pre-op tests, post-operative care and rehabilitation. Either our patients are here in Latvia before the surgery and stay here during all the post-op period, or they just visit Latvia to undergo the treatment and leave in 1 to 2 weeks.